Hi everyone. Today we'll be discussing about non-syndromic sensory neural hearing loss. Congenital hearing loss is defined as children having a hearing impairment of greater than 40 decibel. The prevalence is 1.6 in every 1,000 live birth, where 1 in 1,000 have bilateral impairment and 6 in 10,000 have unilateral impairment. The prevalence increased to 3.5 in every 1,000 children at the age of 5 years old. Half of the hearing impairment are due to hereditary causes, whilst the other half are acquired hearing impairment. Genetic hearing loss or hereditary hearing loss can be broadly divided to syndromic or non-syndromic causes. 30% are due to syndromic, while 70% is non-syndromic. Under the category non-syndromic, it can be further divided into autosomal dominant, which is 18% of the cases, autosomal recessive in 80% of the cases, and rare modes of transmission such as X-linked or mitochondrial causes. Now, let us focus on non-syndromic hearing loss. There are over 100 forms of non-syndromic hearing loss being discovered. The gene loci for non-syndromic hearing deafness are designated by the term DFN, which is short for deafness, and their mode of inheritance. This means that DFN-A resembles gene loci which is inherited on an autosomal dominant method. DFN-B is autosomal recessive, and DFN-X is X-linked. Non-syndromic hearing loss can be broadly divided into 4 superfamilies. The first is gap junction protein, such as connexin 26, 30, and 31. The GJB2 gene is the most prominent hearing impairment gene, which encodes for the connexin 26 protein. The second group is myosin, such as myosin 1A, 3A, 6, 7A, and 15A. Out of this, it is important to remember the myosin 7A, as it can cause non-syndromic hearing loss, and it is the genetic cause to Usher syndrome type 1B and 2A. We'll be discussing about syndromic hearing loss in the next lecture. The third group is adhesion protein. This is due to the mutation of CDH23 gene, which causes non-syndromic hearing loss and also Usher syndrome type 1D. Last but not least is ion channels. It is important to remember the pendrin protein. Pendrin is an anion exchange protein in humans, which is encoded by the SLC26A4 gene. Pendrin gene mutation is the second most common cause to autosomal recessive non-syndromic hearing loss. The mutation of this gene also causes the Pendrin syndrome. Majority of the autosomal dominant non-syndromic hearing loss do not have a single identifiable gene, whilst half of the autosomal recessive non-syndromic hearing loss have a mutation in the GJB2 gene, which is responsible in the production of connexin 26 protein. As for X-linked non-syndromic hearing loss, it is important to remember the DFNX3 and mutation in the POU3F4 gene. Patients with this mutation is also known as the X-linked stapes gusher. They are characterized by mixed hearing loss where the conductive component is caused by stapedial fixation and an enlarged internal auditory canal. It is crucial to note that unlike other types of conductive hearing loss secondary to stapedial fixation, surgical intervention in this group of patients have to be taken cautiously. This is due to an abnormal communication between the cerebrospinal fluid and the perilymph, which can result in perilymphatic leakage or gushing when the oval window is fenestrated or removed, which can result in complete hearing loss. This is an example question that you may get during the exam. What is the most common autosomal recessive gene mutation causing hereditary hearing loss? Is it CDH23, SLC26A4, GJB2, or the POU3F4 gene? The correct answer is GJB2 gene, which encodes for connexin 26 protein. With that, thank you very much for listening, and I hope to see you all back in the next lecture.